actually, like, what is your PhD? Like, what are you taking it in?
Are we recording right now?
Yeah, don't worry about it.
Okay. So my PhD officially is in exercise and pregnancy, because I'm in the exercise and pregnancy lab at Western. But my specialization is postpartum exercise and the impact it has on the mother, so the maternal health, from like weight loss, obesity, but also from pelvic floor health and like postpartum depression. I look at all these different variables, basically anything encompassing mother's health in the postpartum period. So I do some research with breastfeeding. I look at how the infant-mother connection can impact different maternal outcomes as well. So it's really fun. And then my colleagues and my lab mates are doing mostly exercise during pregnancy, but some of them study nutrition.
Yeah.
Some of them look at, chronic disease risk factors. So it's really everything in the realm of exercise during and after pregnancy, a year before and a year after becoming pregnant.
How long have you been doing your PhD for now?
This is my 5th year. Yeah, so it's normally a PhD is supposed to be 4 years.
Okay.
Statistically, though, PhDs are 5 years. With COVID, I basically had to throw out my entire third study because it just wasn't going to happen, and I'd be doing a PhD for 10 years.
Yeah.
We still can't see participants in the lab because because of COVID restrictions and research restrictions. So I basically had to rewrite my entire third study, and I'm just doing virtual data collection. So if there are any listeners who are postpartum, they can be a research participant if they like.
And you have a link on your little link in bio on Instagram, don't you?
Yeah, so at Stronger Fitness, I have my link tree, and it's like if you want to become a research participant, if you want to do stroll, if you want to do virtual training, whatever you want to do, if you want to just save money on meal delivery services, if you want to buy maternity sportswear, I've got it all linked in. But I mean, I've been doing mom and baby or prenatal fitness and training since I was in my 2nd year of undergrad, like the 2nd to 3rd year of undergrad. So that was 2009. I can't even say 2011. It was like 2009. Because the rec center at Western, they built the new rec center in 2007 or 8, and they were hiring aquafit instructors and personal trainers, and all of my friends were personal trainers.
Yeah.
So, and fitness instructors. So I thought about it, and I said, well, if you guys are all fitness instructors and trainers, that means there's going to be less work for me, and I'm going to have to work a lot harder to get clients. So I reached out to one of the managers, and she's like, well, if you want to become an aquafit instructor and get your certification, we'll have work for you all the time. So I did. And
you did aquafit?
That's how I started.
I didn't know that.
That was my start in the industry, was as an aquafit instructor.
That is amazing.
That's why I'm very animated.
I was going to say, it actually makes complete sense.
Yeah. So that's how it started. And then during the summer that year, I had a friend who taught prenatal aquafit, and she needed someone to cover her classes. And there are very few certified instructors like in Ontario. Yeah. So she reached out, and I taught the class, and the women loved it, and I loved it. And so that's how it started. And then near the end of the summer, the first time that stroller fitness was ever held in the city of London, I was an instructor for it. And so that was about 12 years ago.
You're like a pioneer.
Yeah, part of it. I was part of the journey. So at that time, I was working for Rebirth Wellness Center, Life with Baby. And because of that facility, I was able to really just deep dive into pregnancy and postpartum fitness.
That's cool.
But even as someone who was doing it every day, there was so much I did not know. There was so much that was information that was not available to me. This is still a really new research area.
That's what I was going to say. It's something that's fairly new. Like, I think of my sisters who are a little bit older, and when they were pregnant, it's like, no, you don't work out. Like, you just relax. You can go for a walk. But like the thought of doing any sort of strength training prenatal was, I don't know, I feel like that's a fairly newish thing.
Yeah, it's a cultural thing as well, right? So depending on your background, a lot of women are told to rest and eat as much as you need. The baby needs the energy. And what we know to be true through the research is that don't do those things. You should be moving as long as, like, of course, your health allows you to, but you should be exercising. And it's 150 minutes, moderate intensity, just like everybody else. And if you can, you should be eating a nutrient-dense food. So not necessarily eating for two, but we say eating twice as healthy, because the reality is
I like that.
Yeah, right? We just kind of put
That's
the spin
nice.
on it. Yeah. Nice. Because we have seen such an influx in chronic disease in like young adults and kids. But whatever the mother does during her pregnancy not only impacts her infant, but it also impacts her grandchild.
Yeah.
So we're seeing these things last 2 generations in humans. We see it up to 7 generations in rat and mice studies. So that's just, you know, kind of like a snippet of the generational impact that pregnancy can have on your basically lineage.
Yeah, yeah.
So, I mean, we should all thank our grandparents, right? Thanks, Grandma.
Yeah. So you did the stroller boot camp. That kind of helped you realize, like, wow, there's a bit of a void in the health and fitness space for people working with, you know, women that are prenatal. And
yeah, I started going to training seminars for prenatal and postpartum. So I was doing continuing education as an aquafit instructor. I took a prenatal aquafit course, and I was sitting there, and they were going over some stuff, and I was like, I know this, because I had done a lot of the research. And even when I started working with this population, the first person I went to was my now supervisor, Dr. Michelle Matola, because she's like the godmother of this research. And we're very lucky to, in London, have her lab where she's been in for the last 20 years. And so most people don't know that Canada actually has some of the best research in this area in the world. And most of the world and like national guidelines for different countries are actually based on the Canadian guidelines.
really?
Yeah.
Huh.
Yeah. So it's really cool. We are like the forefront, like pioneers for this research, which is cool. And it's because of my supervisor, Dr. Matola. And so when I started working in the industry, I went to her and I said, I have to teach a prenatal aquafit class. Like, what can you give me for recommendations or advice? And she said, well, have you read the Parmed X for pregnancy? And I was like, no. She's like, have you read the guidelines? I was like, no.
Yeah.
And then she's like, I would start there. And so I go there and I look and I was like, okay, yeah, read. And I was like, well, this doesn't tell me how to run an aquafit class for pregnant women. Like, there's nothing in there about that. I'm like, exercise good, aqua exercise good, but there's no class outline. There's no what exercises should I avoid, what exercises are good. So that was the big learning curve for me is actually trying to figure that out. And when I did my undergrad and transitioned into my master's, I did a master's in sport ethics, actually, and I was doing a minor in strength and conditioning coaching. So I was working with the football team, the varsity teams, mostly the men's teams. But what I started to realize is the things that we were doing with the football team from a rehab perspective, if they had any injuries, or even just strengthening perspective, I could take that and kind of apply that knowledge to my prenatal and postpartum women. Because basically what I say is you have to, as a practitioner, especially as a trainer working with this population, you have to realize that women are going to gain weight during their pregnancy. 50% of women are going to gain excessive weight during their pregnancy. So you're working with obese women, essentially. And then you're working with women who are going to undergo a major surgery. So if you're working with a physio for an ACL reconstruction, you're usually, doing some sort of prehab, like preparation for the surgery. Then you have the surgery and then you have your recovery. But with pregnant and postpartum women, we don't think of it that way. And because it's like this natural thing, we forget that pregnancy is a medical condition. It can be very serious. There's a lot of different things that can happen at any stage. And then also after giving birth, that's like probably the first and foremost acute injury a woman's ever going to sustain to her entire body, unless you're in like a severe car accident or you've, played major sports and, you've had trauma in that regard. But I mean, your pelvic floor in particular withstands a lot of stress during and after pregnancy and during childbirth and delivery. So we forget that even though, childbirth is natural, we've been doing it for centuries, that it has a huge impact on a woman's body. And it also, from an exercise perspective, we have to be really cognizant of that in exercises that we prescribe, modifications that we give, and then even coming back to exercise after pregnancy, making sure that we're really kind of planning out that journey. And that from like a periodization, strength and conditioning perspective was what I started to think about. I was like, there's nothing out there like this for women. And also because every pregnancy, every delivery, and then every postpartum experience is so individualized, you have to be flexible. There's not going to be one cookie cutter, outline that's going to work for everyone. But the goal for what I do in my business and in my research is just how do we keep women active? How do we get women active? And how do we do it in the safest way possible while allowing them to do the things that they love to do?
Yeah. So would you say, and I feel like you kind of hinted towards it, even before getting pregnant, if you're thinking of getting pregnant, is there some certain things that you should start to utilize in your training?
Yeah, definitely. I mean, there's a lot of different things you should think about doing. So I was an egg donor too, March 1st, 2020. So right before COVID,
Yeah.
I donated my eggs. And even that experience, I was auditing a nutrition course at Western, and it was with Noelle Martin, who's a registered dietitian. She's amazing for pregnancy and postpartum. And so I walked up to her and I was like, well, I'm doing an egg donation in a couple weeks. What are some nutrition points that you would recommend? She's like, well, are you taking a prenatal? And I'm like, no. She's like, I would start there. And I thought, that makes sense, right?
Yeah.
And I'm like, I know this. This is
I'm
what
not getting pregnant.
Yeah, but you're creating eggs for someone else too.
Yeah.
So I was like, like even someone like myself who knows take a prenatal, it was just having her say that. So even from an exercise perspective, what doctors will often recommend is that you don't start anything new. However, we also have learned in the research and the studies have shown that if you're starting something like walking or some sort of cardio exercise, or even if it's like light aerobic training, so like prenatal fitness or something like that, aquafit, those things are fine. It's if you have never maybe lifted a dumbbell before and you're like, well, now I want to go and join a gym, I'm going to lift a bunch of weight, like that might not be the most ideal. So it's about kind of what do you want your pregnancy to look like? Do you want to be active? What kind of activities do you like doing? And making sure that you build a routine with that prior to getting pregnant. Because when you start to experience morning sickness or hormonal changes, or you're going to have musculoskeletal changes, it's going to be maybe less motivating to want to go to the gym on certain days. So if you can make it habitual even before you get pregnant, that's going to basically set you up for a better habits during pregnancy. And we know that women's activity levels decrease in the first trimester and then in the third trimester. First trimester usually due to morning sickness and just like lethargic, not feeling good overall. Second trimester, we see activities increase again, and then in the third trimester, they tend to taper off as well. So keeping that in mind, you know, that's the natural curve and trend. Habit-based, you know, exercise, even nutrition, thinking about, you know, prepping for a couple days, or if you need help in the nutrition department, working with a dietitian who specializes in pregnancy, because there's definitely going to be different nutritional requirements depending on what you like to eat, similar to exercise, right? But one thing with women, and we were talking about the, you know, eating for two, realistically during pregnancy, you only need to consume 300 to 500 extra calories a day. So when you think about calorie and caloric density and nutrient density, that could be a large ice cap, or that could be, you know, a chicken kale salad, something like that, right? So you want to make sure that even if you have cravings, that you're able to satisfy those cravings in a way that's healthy and that's not going to increase your weight gain trajectory.
Is there a direct correlation between, you know, people who are training before they get pregnant and, like, I don't want to say the easiness of the pregnancy, but like, I guess less complications and things like that?
Yeah, so like activity overall will help decrease and minimize labor complications. And again, that habit of just going, and if it's built into your lifestyle, you're going to do it. What we know in the literature from looking at athletes, so competitive athletes, is that they are usually able to maintain their routine, not to the intensity necessarily, but they're able to maintain a routine during pregnancy. But where they taper off sometimes is more often in that early postpartum period. And depending on what kind of labor or delivery they have, the demands of like looking after a baby, now hormonal changes, breastfeeding, those things impact them a lot more in the postpartum period.
So if, selfishly, one of the main reasons I wanted to have you on is
yes,
my wife is pregnant. So she's in her, oh man, she's going to kill me if she's watching this.
Congratulations. I think she's 20 weeks if I do.
I think she's more. I think she's 22 weeks.
Okay.
Let's just say that. She's due July 10th. We'll go with that. Anyways, we you know, knock on wood, we've been pretty lucky. Like, she did really well during her first trimester, had a little bit of morning sickness, but it didn't really affect her training all that much. She was able to maintain her nutrition for the most part. So, you know, for someone like Caitlin, who was fairly active beforehand, there was just some slight changes that she needed to make during, you know, the first few trimesters. When you're first working with women that just get pregnant, what are some things that you might eliminate from their training that they've done in the past?
Ooh, that's so individualized. So I mean, I work with women who have been active during their pregnancy or prior to getting pregnant. I have worked with women who were not active at all. I work with women who were runners, weightlifters, who are overweight or normal weight. It doesn't matter to me. The key is asking them, you know, what activities do you enjoy and what do you want to continue doing? So the challenge, that's for me not really a challenge, but working with women who are weightlifters or CrossFitters, right? Where they want to, they're used to pushing through pain.
For sure.
They're used to high intensity. They're used to explosive movements. And with those women, I really do have to sometimes pull them back. And this is what I tell all women during their pregnancies. And this goes from who their trainer is, who their healthcare providers are. When you're pregnant, you're in a new health journey. So whatever you did before is not necessarily going to be the best thing for you now. So we can modify. If you like to do CrossFit, that's great. Keep doing your exercise to whatever ability you can. Do not do the high intensity stuff anymore. So taper back the intensity. You should be able to talk to me while you're doing your WODs or whatever. When you're not able to lay on your belly anymore, that's when we eliminate, any like burpees to ground. We start to elevate things. So push-ups, burpees. I usually go by the rule of thumb that each week in your pregnancy, you progress your incline by just like an inch.
Oh, okay.
So that by the end, you're kind of doing like more of an incline wall, push-up or burpee, but that's going to be safer and a lot less stress on your low back and your abdomen than the full horizontal burpees. When it comes to movements like snatches and cleans, your belly is going to impede those movements. So then you're going to essentially be lifting with poor technique, which is going to increase your likelihood of injury, right? So with those movements, I switched to dumbbell. We switched to lighter weight. My question and my comments are, do you really need to do this exercise? Because this is a time in your life where you want to be the healthiest you can be for yourself and for your infant. So just because you can do it doesn't necessarily mean that you should, but also understanding that if you still choose to do it and want to do it, that there could be a consequence associated with it, whether that is, more diastasis, which is that abdominal linea alba line. It's not a separation. It's more of like the fascia stretching.
Okay.
It could be pelvic floor dysfunctions. You're going to get incontinence because you're doing high impact stuff. You're not able to hold your bladder. There's a lot of stress being placed on those muscles. Maybe it becomes you end up sustaining an injury, right? So with women in the third trimester, there's a hormone called relaxin that starts to become released in their system. We don't know exactly when, because every woman's different, but it's released systemically. So that means it targets all joints in the body. And its purpose is to help the pelvic girdle open up to make way for the baby during labor and delivery. But again, we don't know what an increase and influx this has at what stage in the third trimester it happens, because it's going to be different. Women can often just how some people can just kind of do this with their wrist and you'll hear crack, crack, crack. They can do that with their shoulders. They'll hear crack, crack, crack. So when you've got this hormone that's affecting all your joints and basically making you hypermobile, hypermobility is likely to also lead to potential injury.
Interesting.
So with third trimester in particular, we're not doing anything explosive. Everything's nice and slow and controlled. But also because the woman has gained weight because the baby's growing, the placenta's growing, blood volume's increased, amniotic fluid, all that stuff is adding to her overall body weight. Often women will actually taper back the amount of weight they're using because realistically it's hard enough just moving around with themselves that they don't need the extra weight, right?
Yeah, absolutely. Is there guidance around how high your heart rate should go? Like I know you said you should be able to have a conversation with someone next to you. Is there specific guidance of your heart rate shouldn't exceed 155 or something like that?
Yep. So there's the 2019 Canadian Physical Activity Guidelines for pregnant persons. And that was a clinical document that was developed by numerous researchers, clinical practitioners, statisticians all across Canada. And that is the go-to document. And that's been the most recently updated document. And now you're starting to see other countries in the world basically adopt similar guidelines based on those. But it's built on 12 different systematic reviews looking at exercise and its impact on weight gain, so excessive gestational weight gain, cardiovascular disease, diabetes, all these things that can occur during pregnancy. So in there, they actually list specifically like relative contraindications to exercise, absolute contraindications. They give you heart rate ranges. So in the document, if I recall correctly, ideally you would not want your heart rate to get over about the 160. So and it all depends on what, like how old you are and what your current or past activity levels were. So some people might be able to push that range, but then the question becomes, why do you want to?
For sure, for sure. Right. It's like that whole idea of the health continuum as well. Like people that are, perceived as being the healthiest individuals, the Olympians, the athletes, those are actually not the healthiest individuals because they're constantly go, right? Like you want to be somewhere in the middle.
Yeah.
You're eating, 80-20, you're moving every day, but you're not like killing yourself at the gym.
Yeah. And I mean, there's also the flip side too. It's great if you want to exercise and do CrossFit or, even go on runs and things like that. But there's a lot of benefit in the literature to doing things like yoga and Pilates, which are a lot lower intensity, right? From not only a mental well-being, but also to develop that pelvic floor strength and also just kind of be more mindful with your body as you go through stages of pregnancy. So with any woman, I always just recommend and just try to reiterate the point that this is a very unique time in your fitness journey. And so you want to make sure you're surrounding yourself with practitioners, not only your fitness trainers, but also you might love your chiropractor or your physiotherapist, but if they don't have, if they're not certified in Webster technique or they haven't done any credentials in women's pelvic floor health and rehab, go get a new one just for, the duration of the next couple of years, just so you can basically have the most optimal pregnancy and labor and postpartum experience.
What's Webster technique?
Webster technique is actually for chiropractors.
Oh, okay.
So it's a technique that they become certified in. It's a separate course and credential that they have to get so that they can actually do adjustments on pregnant people because there's definitely a lot more stuff that's going on around the pelvic girdle, and you want to make sure that you're cognizant of that. And chiropractors who do Webster technique are able to, and I've heard anecdotal reports from chiropractors and also patients that, their baby was breached and then they were adjusted and the baby ended up flipping on its own because it was,
wow.
Yeah, it has to do with your round ligament.
Interesting.
Yeah, so it's just like little things like that I've like learned over the years. And when I think I've heard everything,
yeah,
someone will tell me about their pregnancy or birth experience and I have to say, what is that?
yeah.
I've trained thousands of women and you're always hearing something new. And because it's still a really new area of research, there's not a lot of necessarily literature out there on certain things. So you really have to, make sure your network, and I have a really great network here in London of practitioners who are amazing and who also work with this population. And so we always like meet for coffee and start talking about different things that we've heard and what we're doing about it. And we pick each other's brains because realistically, it's also a very isolating field to be in. It's not like the community that you necessarily get in a regular gym where you've got people from all walks of life, right? My ideal client, I'm only going to see for maybe 3 years of their life. So during their pregnancy, after, and then if they keep having babies, there's a repeat client. But after that, honestly, I don't need to work with them anymore. They can go back to whatever they want to do because I'm going to help prepare them to do that. So that's kind of my mentality. That's how I've basically kind of grown my training practice and my clientele. And it's what I love to do. It's so fun because, like I said, when you think you've heard it all, then something will happen and you're like, I didn't even know that was possible.
Yeah.
Okay.
No, that's really cool.
Yeah.
So with a lot of the clients that you've worked with, and I know this is like a pretty general question, it's going to be different for every single person, but are there some strength exercises that you would want every single pregnant lady to do?
Yes. So,
and you don't have to share them, but this is like a secret. Like, well, I actually can't tell you because.
Yeah, no. So I'll start with an exercise that I don't want pregnant women to do.
Yeah.
Back squats.
Okay.
So I see it a lot on social media where there's a pregnant person and they're doing back squats. And my question is why? From a functional training perspective, first of all, when do you carry your infant on your back? You don't, right? You're carrying your infant in front, on your side, in one arm or the other. So I basically eliminate back squatting during pregnancy, not only for the functional perspective of it, but also that hormone relaxin. So remember I said it's released systemically. So it affects every joint in the body. Do you know how many joints the spine has? 364. So think about loading a barbell or any weight on vertebrae and joints that are already, sensitive, more likely to become injured. And then also the musculoskeletal changes during pregnancy because the abdominal wall is being stretched out. Even that deep muscle, the transverse abdominis, which is like your internal core set, that's putting and pulling on your spine, and that's causing a lot of extra stress. But that muscle is in a lengthened position, which is a weakened position, right? Like runners running downhill, they tend to pull their hamstrings because their leg is in an extended, their knees extended, right? Their hamstrings lengthen, and then they contract it. So your spine is already in a more compromised position and more likely to be injured. Then you think about babies here, lumbar lordosis, you get that extra curve. Usually women will experience some type of hip or pelvic pain, sciatic pain. That means that their pelvic bowl is shifting, right? So why would I want to load a barbell on somebody's, even just a light barbell? I won't do it. So that's one exercise that I will not do.
And is that immediate?
Yeah, I like third trimester indefinitely do not do it for my clients. And again, I don't have research to support that. My rationale for that is I don't know if I could actually pitch that to an ethics board and they'd approve of it. Like if I actually looked at, if I wanted to look at back squatting and spinal integrity at each stage of pregnancy, I don't know if
it's a good way to look at it.
Right?
Yeah.
So as a researcher, I kind of think like, is it ethical for me knowing what I know to, prescribe that? No, I cut it out. So front squats, so much more functionally beneficial for their core, for balance, for basically carrying baby and everything they're going to have to do during and after pregnancy, right? Biggest exercise that I always implement are carries.
Okay. Yep.
Because if you look
all
at
types of carries,
all
single arm farmers,
all of them. Because if you look at women, if they're not with their stroller and they're just carrying around their car seat, what are they doing? They're basically doing a suitcase carry, right? Some people question overhead carries. I think they're really good because from a balance and just core activation perspective, the further we can get that weight from the center of the midline, the harder the core has to work. Right? So I do a lot of front rack carries and suitcase carries as if they were carrying their baby, carrying their like diaper bag or their car seat, things like that, because that's what you're going to see. So looking at moms in a few months after delivery, what kind of demands are they going to have on their body? And then the risk of cesarean is also pretty high. So we want to make sure that we're thinking about core strengthening in a safe manner leading into delivery so that they're able to basically get that prehab. And then after they deliver, giving them the rest time and then also introducing them to exercise progressively. Because another thing people don't consider, even if you've had a vaginal birth, is you've got a wound inside your abdomen about this big. So, and that's the placenta, right, when it detaches. So if you start exercising even in the first couple days, just like if you scraped your leg and you started like running again, that wound might crack, it might start to bleed again, it's going to impede the healing process. So that's why rest is so important, and that's why we stress it so much in this field. Like you do want to take a solid month where you don't really do a lot of anything. Maybe you do some breathing stuff, maybe you do some light walking, but
this is postpartum.
Once you've delivered, but nothing intensive within that first month. And then my number one recommendation for women is they should see a pelvic floor physio before they become pregnant. So if they're even thinking about pregnancy, go see a pelvic floor physio, get assessed, see what your pelvic floor is like. Then during their pregnancy, get assessed again, and then after delivery. Because as your body changes, your pelvic bowl, which is basically like, I describe the pelvic floor kind of like a wicker basket, like an Easter egg basket. It's like all woven and all these muscles intertwine and overlap. Well, this is holding up all of your internal organs. It's basically like the feet of your torso. And during pregnancy, those muscles are under a lot of stress. but how do you know how much damage is done to them or what's kind of like a normal tightness or strength for them if you didn't assess them prior to the weight or the trauma or the injury? Does that make sense?
Yeah.
So that's like my number one tip. Like as soon as someone's like, I'm pregnant, I'm like, go see a physio. Here's a list of physios in the city that I recommend. And then work with a chiropractor or massage therapists who work with prenatal patients, because again, there's just so many things that can happen, and it's wild. Every pregnancy is so different. It's crazy to listen to women's stories, but you just want to make sure that you're able to kind of check in and see where you're at during each trimester and then see how you're doing after. And the only way to do that is to try to get assessed as early as possible, essentially.
No, that makes sense. That makes perfect sense. So now you have a sip of your coffee. Poor Steph.
It's the only reason I came here. No. I'm just kidding.
Yeah, no. So you have your baby. You take like a month off to recovery. What does like their introduction back into the gym look like? Is it more so, hey, let's just start to introduce some light walks, maybe do some yoga, some Pilates, stuff like that? Or like, what do you usually recommend to new moms?
Yeah, again, this is so individualized. So first of all, most women will get their clearance from their healthcare provider at the 6-week mark. Most practitioners that I know, and even physicians, know that this is really not a great determinant of whether or not you're ready to return to exercise or activity. Because like, you feel good, okay, sure, go do whatever. And then a woman goes back to the gym and they're like, this doesn't feel good. So again, pelvic floor physio, number one step. Light yoga and Pilates stuff is always great too, as long as, again, the person you're working with is certified in this area. But I like to talk about postpartum in relation to what you did during your pregnancy. So from a periodization perspective, I usually start women with like more strength, and then as we progress closer to the delivery date, we start to do more muscle endurance stuff, because labor and delivery can last anywhere from 6 to 36 hours. So my question is always like, how are you preparing for that? That's how I see pregnant women. It's like, you're an athlete and labor and delivery is your competition day. So any athlete that I have, they compete and then they rest. And then what we do is we start kind of like what they were at prior to that competition, just starting off really light and gradually working their way back in. So I start, strength, like more endurance, and then coming back, we do a little bit more endurance stuff, body weight, light stuff only, and then we slowly progress to the strength stuff.
Okay, that makes sense.
Yeah, so.
No, because one of the reasons I wanted to bring that up is I think, you look on the Insta world or on TikTok.
Right? I actually found something that I was like, I want to bring this up during the interview just to, like, it makes me cringe. And I saw it yesterday. So this is the ad.
Yeah, great.
So it says, the workout and nutrition plan I did to drop pounds safely and tone up while pregnant.
Oh, no.
Yeah. Stuff like this. And
is that in London?
No,
I don't want to put anyone on blast.
No, I look up everyone in this industry. Yeah. And she's just like a mom that, liked fitness, did the Instagram thing. She did the ClickFunnels thing. And her website is fitpregnancyworkouts.com. And it's like, this sort of language makes me cringe, because postpartum is not a time to be thinking about losing weight. And the downside of that is, if you're restricting calories during or after your pregnancy, you could basically be at risk for a large or a small for gestational age baby, which means that your infant's going to be more predisposed to chronic diseases like obesity, diabetes, cardiovascular disease later in life. So don't restrict your diet. And then postpartum, if you're restricting your food intake in any way, you could actually limit your ability to breastfeed. So you could actually cut off or reduce your milk supply. So again, is it worth it, right? So things like that really, really just make me cringe to see. And unfortunately, you do see this a lot with the Insta celebrities, where it's like, this is what I did during my pregnancy. And that's great for you, but not everyone is going to have the same experience. And then in addition to that, who are you working with? Yeah. Like, were you training yourself? Are you certified in any regard in this area? Were you working with a trainer? Because oftentimes they won't tell you that, right? If they've got a coach in the background giving them information. But the number one thing is, if you're going to exercise, find someone who's certified, who has an accreditation. And CSEP, so the Canadian Society of Exercise Physiologists, they're the ones who have the guidelines out on exercise and pregnancy. They also have a prenatal and postpartum fitness specialist course. It's a great course. Like, it's based on all the research and literature. If you want to train pregnant women, take the course. Like, if you can't do your due diligence to do it, and you're like, I'm a mom, so, and I was pregnant and I trained during my pregnancy, those are my credentials. I'm like, that's like basically saying, oh, if you you get cancer and you're looking for a doctor, like, oh, like, hey, I'm a doctor, I also had cancer, so pick me. You're never going to go to an oncologist who had cancer. You're going to go to an oncologist because they are a specialist in their field, and they're going to help you with this really unique medical condition you have. So kind of trying to think of like that aspect of selecting a trainer, looking at programs. Honestly, social media infuriates me. And there's some good stuff out there. Like, don't get me wrong. There are good resources. There are good Instagram accounts to follow. But to say, you should do this or you should do that, I disagree with. I'm a person that with my clients, I'm like, okay, I break it down into movement patterns. So you have your lunge, you have your squat, you have your hinge. And within that realm, I have like 3 different exercises. So it's like, how are you feeling today? Do you want to do a barbell Romanian deadlift? Do you want to do a, dumbbell? Do you want to do single leg? Like, how's your balance today? We kind of just fine tune the workout. Like, I have a plan in mind, but realistically, if she's been up all night because her baby's been tossing and turning while she's been trying to sleep, maybe we're not going to do like any squatting that day or any like really intensive exercise. We might just do body weight stuff. So just being able to be flexible. But yeah, like I said, there are some good people out there. There are some good accounts, but in my experience, the best accounts aren't posting their programs on there. And it's not necessarily a cookie cutter thing, but by the same token, if you want to be active during pregnancy and you've got experience training and you've got a good training history under your belt, your body, and you're working with a physio and you've got a chiropractor and your doctor says it's okay, these programs might be good for you because you might know how to modify as you go, but you might not eat as well. So yeah. It can go either way.
Yeah, I think, you talked about it a lot too, right? Like, no pregnancy is ever going to be the same. No pregnant woman is ever going to be the same. Mm-hmm. And I think, like, when you see some of those posts on Instagram, which will be like, oh, I did this after pregnancy and blah, blah, blah. You also don't know what that person was like beforehand. Were they like a CrossFit Games athlete mm-hmm. or an Olympian? Like, of course, their training afterwards is going to look a little bit different.
Yeah. Like Annie Thor's daughter, when she was pregnant, like I watched some of her workouts and people were like, oh my gosh, that's too much weight. And I actually calculated it. I'm like, that's like 60% of what she would normally weight or use for that exercise. So to us, it looks like a lot, but for her, it's not really. And so you need to be aware of that. And a big factor with return to exercise for me, when I do my initial consultation with clients is, what was your labor like and your delivery? Did you lose a lot of blood? Because I know even if I donate, like if I do like my Red Cross donation every year, like I'm kind of not my normal self for a month or two. Right? So as a female, like, what are your iron levels like? Do you get lightheaded just doing, like, getting your heart rate up, going upstairs?
What's your sleep like?
Oh, yeah. Your sleep is crap.
Right?
Yeah. And also the hormonal changes, right? There are so many different fluctuations happening. Your body changes so drastically during pregnancy. Like, everything changes. Even the corneas in your eyes change. Everything's changing. And then you deliver, and then all those hormones just basically get flipped on their sides and upside down. And then you're trying to adjust while also like trying to keep an infant alive, and no one gave you a manual for that. And then your body's like, you don't feel like yourself. You're like, why? The baby's out. Why do I still look like I'm pregnant? Like all of these things are happening. Yeah. And all these good things that you get to
I was going to say, yay! Caitlin, yay.
Yeah, but I mean, it's just, again, you just have no idea. And some women have amazing pregnancies and amazing deliveries and amazing kids, and they honestly feel bad telling people about it, because then you have the woman who, like, pregnancy was hell, labor and delivery was hell, and then their infant's not sleeping. It's a wild card. You don't know what you're going to get. No matter how healthy you are, You just never know.
Yeah, seriously.
Yeah.
Seriously. Fingers crossed.
Yeah.
Fingers crossed, Caitlin.
What are you most excited for? Like, how are you preparing?
I don't even know. It's like, that's the thing.
This is your preparation,
I
right?
know. This is exactly, I'm sitting here just wide-eyed the whole
Yeah.
time. I don't know. I'm just so excited. Like Caitlin, I don't want to go too much, but like Caitlin has always really, really wanted kids, right? So the fact that it's now happening is very, very exciting. And I think it's one of those things where it's like, I don't even know what to expect. And I think it's good that I think that way, because that way, if I never sleep again, which I'm anticipating, then it'll be fine.
Yeah.
It'll be great.
Well, maybe let's go into some of the things that I've heard that like people didn't expect. I know there's like the book What to Expect When You're Expecting, but I don't think that covers everything, especially from a medical perspective. So things like I know women are usually nervous about tearing or having some sort of, we call it instrumental birth. So if you needed any forceps, epidural, anything like that, technically that is an intervention during birth. And the best way to prevent tearing from the research is basically your setting, so where you're giving birth, and then who your provider is. Birthing at home and having a doula tends to be associated with a decreased risks in tears, but that also varies based on the size of your infant, their body position coming out. Women who go to the hospital don't realize that even if they get an epidural, they don't have to birth on their back, because birthing on your back can actually, it actually started because doctors wanted a better view giving birth.
Oh.
So, and this was like back in, the early 1900s when it was like male doctors and they couldn't figure things out. And so they're like, okay, we're going to have you on your back. But that's actually the worst birthing position. I discourage women, if at all possible, to birth on their back. So the alternative is sideline. You can actually lay on your side, your partner can hold your leg up, and that's a better position for you to birth than if you've had an epidural and you basically have to kind of stay in the bed. If you haven't had an epidural, you have a lot more options. So options being you can squat, you can be on all fours, you can lean up against the bed. Some people stand. Like I've seen women give birth standing and heard about it. And those are all good options because gravity helps you. The other thing you want to avoid, and if you can, it's not always possible, but really bearing down to give birth, because that can cause more tearing as opposed to just like breathing through the contractions and kind of letting that baby come out in about 3 pushes. That's going to be kind of the birth, people didn't know what to expect or didn't know that they had options.
Is there like a correlation between like pelvic floor health and tearing as well? I know Caitlin was kind of mentioning that, like women who, am I on something?
Oh yeah, it's super interesting. It's a very interesting field. So what did Caitlin tell you?
I don't even, I was just like, just wide-eyed the whole time.
You're like, what happened?
I just heard pelvic floor, non-tearing. I'm like, okay.
Yeah.
I understand this.
Well, so women who have a cesarean birth think that they're going to experience less pelvic floor dysfunction symptoms. Usually pelvic floor dysfunction is urinary incontinence, but it could also be like anal incontinence. It could also be pelvic pain during sex. If you experience like pelvic pain, even during or after pregnancy, one of the best solutions is actually walking backwards.
Oh.
Yeah. So one of the things your physio will tell you to do is walk backwards. It's a reprogramming of your brain. So I get women to do that, like do sled drags during pregnancy, but like backwards.
Oh.
And that can help alleviate pelvic pain. But women who have cesarean deliveries experience more pelvic floor dysfunction symptoms later in life.
Why is that?
Because they never actually treated their recovered, had pelvic floor rehab after childbearing. So just because you delivered via cesarean, yes, now you're dealing with an abdominal incision, but you still had pelvic floor, like weight and stress on those muscles of the pelvic floor. Then with tearing, in France, for instance, it's a country where any woman who gives birth gets a script to go see a physio right after. We're not there yet in Canada, but every woman, regardless of delivery, should go see a physio, because even if you have a little tear, it could be there's 1 degree, 2 degree, 3 degree, or 4 degree. One degree tear is just like a little tiny tear, usually like 1 stitch. You're probably okay. 2 degrees is a little bit bigger, 3 degrees is even bigger, and 4 degrees is like a complete tear. And regardless of any of those, you've still torn tissue, and you should still go see a physio. Yeah. And so the sooner you do it, the better you're going to be long term. Just like any rehab, right? Like the sooner you address it and work through it, the better off you're going to be. And the key with most women that I work with is like, okay, let's get you ready for your next pregnancy. Because women usually see me during their first pregnancies, and then I know that they're going to have more children. Most women do, especially in Canada. We have an average of 2 kids per household. So it's like, okay, how was that pregnancy? Now let's get you ready. Let's get you recovered so that the next one's even better. And just because you didn't do certain things in your first pregnancy doesn't mean you can't do them in your second. And there's women that I've worked with that I've trained completely differently during their pregnancies. And I've kind of had my own little like research tests.
They're like your guinea pigs.
Yeah, kind of. Like anecdotally speaking, the one thing, and I have no research other than my own anecdotal experience to validate this next statement, so do not take it at heart. But I trained a couple women who were really petite and gave birth to, had children in the past and gave birth to like smaller and lower weight babies. And I just put them basically on a strict strength hypertrophy training program with me during their pregnancy. And their infants during those pregnancies weighed more. Like they were 2 pounds heavier, giving birth at the same time. And I'm like, okay, there's a lot of factors here. It could be it was also 2 different dads, so it could be different fathers. But then the last pregnancy, this person didn't train with me, and then she had a low birth weight baby again. So I thought, is it the weight training? Is it testosterone? Because like weight training increases testosterone. Does that does that transfer to the infant? How would that affect it? And really, I don't know what the answer is. Yeah. But I think there's definitely something to be studied there. So if there's any researchers out there, you want to take on a new research experiment, there's a whole PhD in and of itself. But that was one thing, just anecdotally, I was like, it's so strange that when you were doing a heavy, like when your training was focused on strength and hypertrophy only, that you had a heavier baby than all 3 of your other pregnancies. Yeah. When you didn't do that.
And it's not like it was the last pregnancy or the first pregnancy, it was the middle pregnancy.
Yeah. Huh. So yeah, just something random like that. And so women who maybe have, the thing about multiple pregnancies and weight loss in particular, like I know we don't want the focus to be on, weight loss during pregnancy. After you give birth, what I tell women is don't worry about weight loss until you're done breastfeeding. Once you're done breastfeeding, you're going to, over the course of a month or 2, your hormones are going to reset and re-regulate again. And that's when you basically want to get back to your baseline weight before you got pregnant. So being active while you're breastfeeding is really great. Breastfeeding itself is going to help reduce some of the mostly the adipose tissue that you've gained during your pregnancy, obviously thinking about diet and keeping that in mind. But statistically speaking, 50% of women will still retain 10 pounds or more at 6 months postpartum. And of that, you'll have 25% that retain 20 pounds or more. So now for their next pregnancy, they're starting off at a higher weight, higher BMI. And if they've jumped BMI categories, so maybe they started in a normal weight category, they got pregnant, now they're overweight, they want to get pregnant again, they're starting their next pregnancy overweight in that BMI category. And so BMI, take with a grain of salt. For people who lift heavy, CrossFitters, BMI is not as accurate as the general it would be for the general population, but we ideally want women to get back to their pre-pregnancy weight and maintain that weight for a few months prior to becoming pregnant. So you know how we talked about prepping for pregnancy? Your first pregnancy, get into that routine. For your second or third pregnancy, we want to see you from a clinical perspective, get back down to your pre-pregnancy weight and maintain it. If you don't maintain it for a few months, it's like that yo-yo dieter, right? You're going to decrease and then you're just going to end up gaining back even more. And we see that where women actually followed diet plans, lost a bunch of weight between pregnancies, but because it wasn't sustainable, they got pregnant again, they gained it all back within a short period of time. So that's where, if nothing else, working with a registered dietitian between pregnancies is really beneficial, because that above exercise is going to be mostly the determining factor of how effective that transition will be.
You're going to be pretty active chasing around your kid anyways.
Yeah, definitely. So, and again, with postpartum, my area is trying to get women engaged in activity, because we've seen lots of really great research ideas and study ideas for postpartum women. The number one limitation is adherence. We can't get women to actually follow the program because of time and because of childcare. So if they can, do their activities with their kids, that's usually going to increase their ability to go to the class, to adhere to the program. 30% of women will drop out because they just don't have the time. So that's why I love stroller fitness. That's why I love mom and baby fitness, because you're killing two birds with one stone, essentially. But even still, you're going to be limited based on what they're eating and how they're eating. And what I usually tell women to do, depending on, where they're at, is whenever you feed baby, you should eat. Not necessarily a full meal, but you should have a snack, because breastfeeding, running around looking after your kid, it takes energy, right? Carrying your child, you're carrying 10 pounds with you, holding it all the time, in addition to whatever weight you're still holding on to from your pregnancy. So you're going to burn energy. You also want to be replacing that energy with some good, quality calories, fats, carbs, proteins.
So postpartum then, are you, in terms of calorie intake, is it similar to when you're pregnant, around 300 calories more to offset?
500, yeah, 300 to 500.
300 to 500,
yep.
Okay.
Yeah.
And then with stroller boot camp, I do want to touch on that, because I think it's a good little segue.
Yeah.
So you have a stroller boot camp starting, or I just saw there's like sign up. Are you full already?
Oh yeah. Well, I opened up another section.
I don't. Can you explain stroller boot camp to me? Because all I know is every once in a while I'll go on a run, and then I just see Steph
like, hey, Isaac,
with a bunch of people.
Yeah,
and,
it's so funny because all my moms that I work with, they're like, because when you're running, let's not lie to the listeners. Sometimes you're shirtless. You may start with a shirt on, but you're not running around with a shirt on all the time.
Yeah,
so it's funny because I'll see Luke, who's another coach here, and I see a lot of like my male friends running on the trail shirtless. Yeah. And I'm like, hey, and like high five. And all my moms are like, who are all of these shirtless, attractive men that you know? It's good. They enjoy when you run by. So, it's my session. So Stroller's how I started with the postpartum group training, and I love it because it's just such a great community. But I'm very kind of militant in that. I really want you to see a physio. Like, you shouldn't be at the end of your 6 weeks with me and you haven't seen a physio yet, because we're going to gradually increase intensity. We're going to gradually implement more jogging into running. And then by the 6 weeks, we sometimes even start doing plyometric exercises. And so you need to make sure that you're looking after yourself from the inside out. I can assess for diastasis. I can see how your abdominals are contracting. I can tell if your glutes are contracting. I can give you form tips on your running or different exercises. But what I can't do is assess your pelvic floor. And at the end of the day, that's going to be like the number one determinant of your health moving throughout your life, because whatever you don't assess or address during and after pregnancy, you're going to deal with in menopause as a female. So it's just so important. But I run a 6-week stroller fitness program. I used to call it stroller boot camp, but I thought boot camp became very intimidating. And so basically what it's meant to do is it's progressive in nature. So we start very basic, and each week we just kind of build volume, build intensity, while like getting to meet other moms. And it's such a fun group of women to work with, because they're already like motivated. They want to get out of the house. They're really excited for this time. And then whatever they're going through, there's another mom in the group that's going through the same thing. So it really facilitates that like community bonding, motherhood. And yeah, it's great. So I'm doing 6-week sessions. I've got them running all summer. There's Monday, Wednesdays, Tuesday, Thursdays. And then what I'm doing as well is every second and fourth Friday of the month, I do a drop-in.
Oh, nice.
So just in case people just want to try it, or sometimes people have family visiting from out of town, like sister-in-laws who also have kids, and they want to come out, bring them out. Like, Fridays are meant to be fun. And for your listeners, actually, I already did this, but I made a promo code. So, yeah. So if they use MVMT, they can save 10% off any service or product. So yeah, they can do that. But it's just basically, it's there to facilitate community. And for me, it's great because it helps me stay up to date in all the trends that are going on. Like, what's the must-have toy? Sophie Giraffe is still the must-have toy, like 18 years running.
Sophie Giraffe?
Sophie the giraffe. Like, it's like a teething toy. Yeah, okay. Everyone has it. So you have to have it. But yeah, it's really great. And like I said, the women that I get to work with are awesome. And it's really cool seeing women go through multiple pregnancies and see like running into them then, you know, downtown London or at a convention or something. Cool. And like you see their kids and they're older now. It's like, I remember when you were like in mommy's belly still, you know? It's so fun. And yeah.
So it's once a week or is it twice a week?
It's twice a week. And then there's the bonus class on every second Friday for anyone who wants to join in.
And when do the sessions, like I know you said Monday, Tuesday, Wednesday, Thursday, or whatever it was. When does it like start? Was there like the stroller fitness season?
Yep, the season starts the first week of April.
Oh wow, so it's coming up.
Yeah. So we usually go first week of April to the last weekend in October.
First weekend of April, the last weekend of October.
Yeah, and some programs move indoors in the winter. It's been challenging to do that with COVID. A lot of people won't allow indoor programs. So then during the winter months, I just do virtual stuff to kind of keep people accountable, keep them kind of in that group setting. But it's not the same. There's a lot of research talking about just being outdoors, right? Sure. Right? Like we know that going outside, you feel so much better. And with postpartum women, pelvic floor dysfunctions, something we want to think about, but also depression. And there's a direct link between those two. So women who experience pelvic floor dysfunction postpartum, they're 30% more likely to be or have anxiety and 20% likely to suffer from clinical depression. Yeah, so there's a direct link there. So that's actually what I'm looking at in my third study, is looking at the relationship between physical activity, postpartum depression, and then pelvic floor dysfunction. Because physical activity, if you're doing like low intensity stuff, moderate intensity, usually that helps decrease your likelihood of depression or depressive symptoms, and it can also decrease pelvic floor dysfunction. But there are some times where physical activity actually increases pelvic floor dysfunction. So then if you're increasing pelvic floor dysfunction, are you also increasing depressive symptoms? So are those counteracting the benefits you'd get from exercise? So that's what I'm kind of examining, like what has the most impact on the other? What should we be focused on for postpartum women if we're trying to decrease their depressive symptoms or reduce the risk of developing postpartum depression clinically?
Wow. Okay.
Yeah.
I just had something and then it escaped me.
I kept talking. I know.
No.
I saw your eyes light up and I was like,
oh, no. That's okay.
But yeah, so yeah, the season's coming up, but yeah, it's gonna be a fun season. So I always tell women like twice a week is great for activity postpartum.
For sure.
Like if you can go for walks on your own and do some yoga, that's amazing. But if you can get out for an hour twice a week, you know, that in and of itself is sometimes a big ask, and that's what we're all about at Stroller. It's just like, even if you didn't sleep the night before, just come out, walk the whole time. At least I'll hold your baby for you or push your stroller if you need me to.
It's free daycare.
Yeah, exactly. It really is.
But no, I think so much of it is the community aspect as well. Like I know Caitlin was saying, she's like, oh, I want to do stroller. I'm like, okay, well, perfect. You can go with Steph.
Yeah.
But she's like, the biggest thing is just to like meet other new moms, like people that are going to be at the same phase as where you're at, I think is really powerful.
Oh yeah, definitely. And like, again, because babies are so different, but at the same time, babies tend to follow the same kind of like developmental curve. So it's nice to have that interaction. And with COVID in particular, we see a huge impact on kids and infants, like not meeting their developmental milestones because they're not around other kids to learn and to kind of like compete. Like, you know, the second child always develops sooner because they're watching the first child and they're like, oh, my brother or sister's standing, I want to stand, you know. And that's the same thing with infants. And a lot of people don't know that infants also have their own activity guidelines.
Really?
Yeah. There's actually activity guidelines for infants. So the biggest thing is...
At what age?
As soon as they're born.
Interesting.
Yeah, so you want to limit the amount of time a child, an infant, spends in a car seat or stroller to an hour. So that's why my classes are only 1 hour in length, because you actually don't want your infant in a supported position, because then if they're supported on an incline, obviously when they're little, they need that support and for their head and neck, but you don't want them like that all the time because they never learn to then lift their head up. So we call it tummy time. Your infant should always be like flat, either on their back or on their belly as much as possible, so they can build up their own little abdominal and like core and back strength to learn how to flip. Because you know, like banana rolls for adults are hard.
So hard.
Right? So like think about if a baby can do that,
yeah.
that means they're building up enough core strength, then they can start to work on pulling and crawling, and then they can start to work on standing. So a lot of people don't know that it all starts with, you know, how much time they're spent in a supportive seat and position. So if you can get them as flat as possible all the time, that's best.
So for your stroller fitness, are there, sorry to keep on going on this, it's just, it's near and dear to my heart right now. Is there a specific age that, like, or is there a specific, well, I guess postpartum that you're looking for? Is it a month, 2 months? I know it obviously depends where they're at, but do you have like guidelines on your site or anything like that?
Yeah, so usually when the mother's cleared, which is around that 6 to 12 week mark, depending on her delivery, usually the infant has had enough head and neck strength, but I always recommend even just like making sure there's enough support within the stroller. And most strollers and car seats are really well built now, like the technology's come a long way, but 6 weeks to 8 weeks is usually the earliest I'll see a stroller participant.
And then is there, like if someone has 2 kids, like 2 young kids, do they bring both kids out?
Oh,
How does
yeah.
that work? Okay.
Yeah, as long as the kid is okay staying in the stroller. And I have women who, I started running a drop-in class for women who had returned to work because they just missed like exercise. They still had their kids, so they wanted to be able to bring them. But when you're working with a 2 or 3 year old, like a toddler, they don't want to sit in the stroller. So what we did for those classes, we just stayed in one park. And then the moms did some running, and then the kids kind of just stayed and played. So then they're getting me as the babysitter
Yeah.
and then the instructor too, the coach. So that's, I usually say like after the age of 3, or if your kid doesn't want to sit in the stroller, then, you know, it might not be as feasible. But I do really try to do my best to make sure that the kids have a good time too. So even if you bring an older kid to class, I always try to end at the park. And I try not to stop at a park so that like the kid doesn't get mad they have to leave. It's like, no, we're going to go to the big park at the end, right? As an instructor working with this population, you do have to be flexible, but you also do have to plan things out because, yeah, if someone like I've had women come to class pushing 3. Like they had twins and then they had like an older infant, and I was like, good for you. Like, kudos to you. And then that just shows like how determined they are to get back into it and to meet other moms, right? If they're willing to push like a 3-seated stroller.
It's funny. I didn't even think of the running by a playground or by a park.
Yeah.
That'd be horrible. You're just this little 2-year-old and you see all the swings and everything. You're like, no.
Yeah. I had a mom who brought her older, he was, I think, just 2.5, and he loves trucks.
Yeah.
And you know, at Ann Street, there's the gravel pit.
Yep.
So I would, when she brought him out, we would purposely stop there so she could just turn the stroller and he could just watch the trucks.
That's cute.
Because it's like, the moms don't care where they stop. They're going to get the same workout. But like for him, he was the oldest kid. And if we stopped somewhere and he wasn't going to be distracted, he'd probably want to get out of the stroller. He'd probably want to run around, you know, and then the mom's not getting the best experience, right? My goal is to look after the mom and to make sure that my mom has the best class ever, because again, that might be 2 hours of their week that they spend with me. And so I want to maximize that for them and give back to them. So it's like, you can bring your kids, just let me know in advance so I can kind of plan our stops, you know? But, so for you, because you're going to be a stroller dad.
Okay, that was going to be one of the questions I saw on your Instagram. Are you doing a stroller like dad camp?
I loved it. It was fun. You know, I'm going to say this. It's going to sound so bad, but okay. I gave the dads some of the same workouts I gave the moms. And the dads did not handle them well.
Yeah, no, we'd be wimps.
Yeah. Like, you guys were like, I feel sick. I'm like, oh, man. I'm like,
we're not as tough.
I didn't think it was that bad.
No, we're not as tough.
Yeah, women are tough. So I was thinking about doing more like a family fit.
Nice.
So even if you have a couple kids, even if it's just like the dad that wants to show up, I'm thinking about doing that once a week. Yeah, because with the clients that I've had in the past and the demand that I have from women who are back at work but would love to come out once a week and just do something, I'm considering doing the stroller dad. I just don't know if I'm going to do like a drop-in again, or if I'm going to do like more of kind of like a 4-class pass thing.
Especially when you're in such high demand for your stroller fitness for the moms, right? Yeah. Like I get it.
Yeah, and honestly, it wasn't the dads that signed up; it was their wives.
Yeah,
like. All of the, like, I think maybe 2. And it was, the reason they signed up was because their wife was like, hey, look at this program, you should do it. Like, take the kid, get out of the house.
Yeah.
You know, like, just so they, and even that, I thought it was really interesting because I have friends who are in like homosexual relationships, and they're experiencing the stage where they're like, okay, well, we want to do like dad things and dad fitness, but we can't. Like, there's nothing out there for the dads, right? So that's why I started it. So it's something that I'm considering. It just depends on the demand. What I usually tell people is if I can get 6 to 8 people signed up that are like committed, I'll run it. I'll run it. So if you are interested, we can definitely look into that because, it's also great for dads to meet other dads, right? Like it's honestly, yeah, you guys can have your conversations. The kids are out. And then it's funny because the dad will be out and the baby will be screaming.
What do I do?
Yeah.
Steph?
And I'm like, I don't know. She does this with mom too. So just deal with it. Like, and then like the dads are freaking out, but it's also, there's a little bit more sympathy there than because they see what the mom goes through even while they're trying to exercise and stuff. And as a parent, you are so focused on your child, you only hear your child. I can have 5 babies screaming in a class. I don't hear any of them.
Yeah.
But the mom will be like, I'm sorry, my kid cried the whole time. I'm like, honestly,
I didn't
know. Just keep working out. They're going to cry anyway, right? Yeah. If they're going to cry, they're going to cry. But it's the difference between you getting the workout in for yourself or not. So just get your workout in. I'll push your stroller in. Like while the women are doing circuits, I'll have like one stroller at my foot that I'm rocking, and I'll have the other ones in my arms. I see
it all the time. Is there a specific type of stroller people should have? Like, I know there's running strollers, and then there's whatever your more conventional ones. Is there like one that you kind of recommend to people? Yeah,
honestly, the 3-wheel jogging strollers, I'm not a huge fan of.
Oh, I thought that's what you were going to say to go with.
No, okay. I've seen them come close to tipping a few times.
Oh.
Yeah, especially with jogging and running and stuff. And you know that the trail, I mean, some trails are better maintained than others. Springbank's a little bit better maintained than Gibbons. You've got a lot of ruts and stuff. The 4-wheel strollers are the best that I've seen. However, there's the Chariot. I think it's by, she's going to kill me. It's an expensive stroller. The Thule strollers are amazing. They're expensive, but they're amazing. Like, I want the Thule strollers because they're made for even rough terrain, right? They're good for that. But I think it's the Bob, and it's like aluminum, and so it's lighter than than any other stroller. And the client that I had, she had a 2-year-old and then an infant, and she was pushing it, and I was like, you could literally just push it with your finger. It was so smooth. It did so well, but you're going to get what you pay for. Yeah. That's the sad part about it. What I recommend is if you're planning to have more than one kid, invest now in the 2-seater, like hardcore stroller, and then you have it.
Yeah, because the bigger question was more just there's not a specific type of stroller someone has to go to stroller fitness. No. It's like
I've had a mom show up with like the bougiest like high-end stroller, and she was fine.
Yeah, okay.
You know, like it was like
there's a remote control.
Yeah, like I had never seen a stroller like it before. It was not a running stroller. Yeah. It was not a jogging stroller. Yeah. But it's fine. It'll all work. It's just more like how much work do you want to do?
Sure. Okay.
Yeah.
Cool.
Yeah.
I think it's been over an hour.
I know. I knew that.
And I could talk to you for another 4 hours because you're telling me how to raise my child.
We can do a part. Great. You know what we should do? Well, actually, have you ever watched Ali Wong on Netflix?
I've seen her first 2. She has a new one.
Oh,
I haven't watched her new one. But I've seen her
those
first
are so good. But we could do something like that where it's like before baby,
and then after. I'll just be all disheveled.
Yeah, like dark eyes and like. Oh, it's been good. Yeah.
Yeah, it's been great.
But who knows? I hope you have like an amazing baby who sleeps through the night and stuff. Like, and I've heard women who are literally just like, you know, I let my baby cry themselves to sleep. There's a part of it that is the infant, and there's a part of the training that goes along with it. But the biggest thing is knowing that you're not alone going through stuff. Yeah. Breastfeeding in and of itself can be a very daunting experience for a new mom, and the ability to latch. And that can be a lot of factors from the infant to the mother. So there's lactation consultants, right? If I were you and I was going to get Caitlin a gift, I would get her a doula.
Yeah.
Mm-hmm. So when I talked about tearing, we got onto the pelvic floor stuff. And then I stopped talking about healthcare providers. But in the research and the literature, basically the top way to decrease tears is having a doula at your birth.
Huh.
because they just are trained in relaxation techniques and certain massage techniques. They're also really great to help get the partner involved, because as a male, you know, it almost feels like you're watching, you know, you're an outsider, where they actually get you really involved in the birthing experience. So I would recommend a doula, and they're, I mean, relatively inexpensive, and they're available. If your labor is 36 hours, they're there for 36 hours with you.
And they help you afterwards as well, right?
Yeah, they'll actually come to your house. They'll cook for you. They'll clean for you, whatever you. Yeah, no, they'll do. People don't know this, but they will. And so there's a lot of great doula services. I love Sweet Stella's. Shannon's just amazing. She trains a lot of the doulas in the city, and she's wonderful. But Rebirth has doulas. Compass Rose, if you're more Kamoka Kilworth, they have doulas. But even like a midwife or an obstetrician, they have backup doulas. So even if they have like 2 births that end up just happening to fall on the same day, they'll have a backup doula that you've met and that you're comfortable with. So basically kind of like, not necessarily your obstetrician, because a lot of times you can't pick your primary provider, but like with a doula, you have more say in the selection. So you find someone that you jive with, and then they'll help you like pack your bag to go to the hospital. And then, like I said, their involvement is helping you stay involved in the delivery and making it as comfortable for your partner as possible. So that's my, other than pelvic floor during pregnancy and after, doula. Like get a doula, a doula. They're amazing.
We've
and
heard
they're
that
so
from
helpful.
A few people.
Yeah, 100%.
So much to think of.
Well, I hope we like checked a few things off the list. Is there anything else?
No, this is really good. The big piece for me was like wanting to get a good understanding of, you know, prenatal and postpartum fitness and how that's related. Want to talk about stroller, which was a big thing, and then just hear your wealth of knowledge, because I know like this is an area that you're so passionate about, and you can definitely tell that when you're speaking about it. So
it was funny. I was telling Isaac, for everyone who's listening, to prep for this interview, I just started reading my dissertation. I was just like, okay, let me know some of the stats again, so at least when I say things, I actually have some numbers that are attached to the comments and statements I'm making. But I mean, again, it's such a cool, crazy, fun time in someone's life. And some women, their experience isn't super great, and some women have amazing experiences. And it's you're never going to know what that is until you go through it. So I mean, as a partner supporting someone through this, like, good job. Like I think you're probably crushing it, but always like feel free to reach out. Like there's definitely one thing too, like childbirth ed classes, and just kind of prepping yourself for what might happen, because it might be difficult to see your partner, the one you love, in so much pain or in so much discomfort and really feeling helpless, that you want to make sure that you're kind of prepped. And that's why I say like doulas are great, but I hope that you feel like more confident with some of the stages of pregnancy and kind of like what she's going through and what to expect. Yeah,
I think that's actually probably would be the one thing I'm most worried about. Is obviously, like, I love my wife so much, seeing her go through that much pain, like, oh man, that's going to be, I think, the most difficult part for me. But we'll get through it. We'll get through it. You have to. Baby's gonna come either way. It's coming out. I was talking to Caitlin the other day. I'm like, because obviously she's been reading a ton on, you know, what to expect and things like this. And I'm like, are you ever scared like of delivering? And she's like, no, it's like, it's going to come out no matter what, right? So you just need to kind of know that going into it. But she's killing it. She's doing really well. Awesome. Good to hear. Cool. I'm so happy to hear it. So we're going to have you back on. My thought would be is, you know, we can get a bunch of questions from some of our expecting moms, some of our new moms, and then we can go through and answer those. But I think that would be great, actually, if you can have people submit some questions or do any survey. I can do a poll on my Instagram as well. Like, it would be interesting to hear from dads too, like as a dad, you know, what kind of things are you nervous about or not expecting, but then also from a female perspective, like how did everything go? Was it what you expected, right? It's cool. Yeah. Cool. Well, thank you for taking time out of your busy day. I really do appreciate it. Yeah, happy to be here. Awesome. Good to see you. Thank you.